Hello, my name is Dr. Charles Weaver. I am the founder and publisher of the RA Connection. I want to thank you for joining us today for a web chat with Angela Durazo on communicating with your doctor about rheumatoid arthritis. In 2011, as Angela began her journey towards qualifying as a professional long-distance triathlete, she experienced stiff, painful hands and wrists. Angela, first thinking she was sleeping in a weird position, soon realized something more complex was going on. In 2012, 7 physicians later, she was diagnosed with rheumatoid arthritis. Angela's body rejected the initial biologic treatments, and her RA flared. Bedridden due to pain, with a permanent loss to the range of motion in her hands, arms, and shoulders, she went from being a competitive triathlete to being unable to walk or open a water bottle. Responding poorly to conventional treatment, Angela sought relief through DHEA treatment, changes in diet, supplements, and physical therapy. Angela was determined to get back to racing and earned her first amateur top 3 placement in 2013, only 10 months after her RA diagnosis. That same season, she qualified as USA Triathlon top 10% in the nation in her age group against able-bodied athletes. In 2014, Angela raced professionally in a paraphysically challenged division. Years of athletics had taken their toll, however, and Angela decided it was time to start a new chapter. Angela relocated to Los Angeles and is currently working on her first film. Angela works directly with a team of supportive medical professionals, keeping an eye on her disease, attempting to prevent further damage. While her path might be a unique one, she is hoping that by breaking the rules, she is writing new ones for others who might find themselves in similar shoes. I will now turn the presentation over to Angela Durazo.
My name is Angela Durazo. I am a former professional triathlete with rheumatoid arthritis. I raced for 6 years and I was diagnosed about 3 years into my racing. And it was a really interesting journey. And ultimately in January of this year, I decided to retire from racing and transition into acting full time. And so now I relocated to Los Angeles and I am an actress out here working on my first feature film. So I want to talk to you today about how to create a very solid foundation in partnership with your doctor and how you can, work as your own advocate with your disease management and disease activity and just kind of creating a game plan. For the first couple months, I just started experiencing pain in my wrists and I would wake up with really bad stiffness. And I didn't understand what was going on, and I thought that maybe I was training wrong or I was sleeping wrong, and I thought that, there was something that I was doing. And so I became hyper aware of the activities that I was using, my hands for and the things that I was doing with my hands. And then after a couple more months, it just wasn't getting better, it was getting worse. And so intuitively, I realized that there was something that was going on with me. And it was very difficult to deal with. And at that point, it kind of developed more from stiffness into a searing pain that I had up and down, this bone in my arm and stuff. And so I would just wake up in the morning in this pain. And then at the same time, it started to get very difficult to think clearly and articulate myself. And I would go in for training with these other athletes and I just couldn't keep up anymore. And I was just having a really difficult time. So I went to my doctor, my primary care doctor, and I told her the symptoms and stuff that I was having. And I tried to express that I was concerned. And she told me that I was overtraining. And I had to kind of go back and forth with her and say, look, I'm training under one of the top 3 coaches in the world, top 3 triathlon coaches in the world. And we've discussed this. I've discussed this with my physical therapist. I've discussed this with my coach. I've discussed this with, my biomechanics specialist to make sure that there's nothing that I'm doing wrong. And we've covered all the bases that it's not something that I'm doing. Like there's actually something going on with the body. And my doctor didn't believe me. She told me that it was in my head and I was overtraining and I was a hypochondriac. And at that point, I became very insecure and very upset. And I began to question myself. I was like, is there something wrong with me? Am I creating problems in my head? But this feels really real, and so I just kind of went through that. And then I went home, and then for the next week, the pain just kept persisting and getting worse. I made another doctor's appointment with her and I said, look, I think there's really something going on here. And she said, Angela, I think that it's just your athletics and your overtraining. And I said, can we do some blood tests to kind of explore things? And she said, I don't think that's necessary. And I said, well, I don't think that you should be my doctor anymore. And so that was a really difficult thing. And I think that at that point, it was my anger that made me fire her, just because I was so mad that someone was making me feel like I was making this up in my head. And I couldn't communicate to her. I just couldn't seem to get through to her and for her to believe in me. And so I had to accept that, and I fired her. And then I ended up going through 7 more primary care doctors to even get a referral to anything. I would go to a doctor, tell them what was going on. They would look at my history. Oh, well, you're going to be a professional athlete. You're overtraining. You're doing this wrong. And so after like 6 months and 7 different doctors, I finally, I called up my best friend who was in medical school at the time. And I said, look, this is the issue that I'm having. And then at the time, let's take this thing off. At the time, I started to notice some curvature in my finger, which is the ulnar nerve deviation. You can see a little bit right here. And I just noticed that my hands were starting to change. And so I talked to my friend that was in medical school. I sent her some pictures and I said, hey, this is what I have that's going on. I'm in some severe pain and none of my doctors are taking me seriously. And so we discussed rheumatoid arthritis. And she's like, Angela, I feel like you should go to your primary care doctor and you should tell them that you want to rule out any possibility of rheumatoid arthritis. And hearing that, and then kind of having to go to my doctor with that was very scary. You know, I searched it on the internet and I looked at what it was, and I prayed to God that it wasn't that. So I went to my doctor and I said, you know, my fingers are starting to change now, and I would really like to rule out rheumatoid arthritis. And she's like, okay, let me refer you to a rheumatologist. Let me get you some blood tests and do this stuff. And so the blood test came back. I didn't have the rheumatoid factor, but I was positive for antibodies, and they lined up some x-rays. I got into a rheumatologist 2 weeks later, and then my rheumatologist diagnosed me with rheumatoid arthritis. And so the path of getting there through all the primary care doctors took me about like 6 months to do, and it was frustrating and it was exhausting, and it made me question my own sanity. But once I guess I started to actually show symptoms of rheumatoid arthritis, then I was taken seriously, and then I was diagnosed very quickly. And so for me, I think the thing that kept me going through the 7 months, even though everybody was telling me that I was a hypochondriac, was that like intuitively I knew, and I was just angry. I was angry that people were telling me that there was something wrong with me. I was angry that nobody would listen to me. And my mom taught me from a very little age that if you believe something, you shout from the rooftops and you do what you need to do to make sure that they listen, because eventually you're going to exhaust them. And so that's just what I did. And I would go home and I would cry at night and I would get discouraged. But at the end of the day, I said, okay, I'm going to go and I'm going to find another doctor. And there's got to be someone that's going to believe me. There's got to be someone that's going to understand me. And so I just exhausted pretty much every resource that I could during that time. And that's how I got my diagnosis. And so it wasn't like it was easy, or even dealing with the healthcare system and trying to get a referral. Like, I didn't understand why my first doctor just didn't refer me to a rheumatologist, because it's not like there could have been any harm done and I just would have paid a copay. Like, it would have been fine. And so I feel like there was a severe disconnect with preventative care that could have happened, because the first 2 years of having rheumatoid arthritis is when we get the most significant damage in our hands and stuff. At least what I'm told. That's what I'm told. So that's the impression that I'm under. And so for me, I felt like it was a time issue. And the 7 months that I wasted trying to convince a doctor there was something going on was the 7 months that my fingers were permanently damaged. So, so now speaking publicly and doing all this stuff, I really want to put emphasis on the fact that as patients, we have to fight for what we know, even if someone tells you that you're crazy or that you're making it up or that you're doing something wrong or something like that, if you know in your intuition that something is just not right, you have to fight for that until they listen, because eventually they will. And so that was ultimately how I ended up getting diagnosed. And then I went and saw the head of Scripps rheumatology from there. And then I relocated to Los Angeles last year, and now I'm at the head of I see the head of rheumatology at UCLA and stuff. And you know, now my management of my disease is going well, but it was definitely like it was an opportunity for growth trying to get the diagnosis. That's how I look at it now, because it was so difficult. It was an opportunity for growth that I believed in my intuition. So going through this journey now, and after having the diagnosis and having established relationships with my primary care physician and with rheumatologists and internal medicine and all of these doctors, I think that cohesively it's just vital to have very honest communication. And so whenever I go into my rheumatologist now, I go and I have, you know, an app that has a list of questions that I have and stuff like that, and I use my RA and I track my symptoms and I bring that into my rheumatologist, and it's proven to be vital to be honest about, you know, the ups and the downs and the things that are going on. And through that is really what's been kind of the breakthrough for me in my relationships with my doctors, because when I first saw my rheumatologist, I told him the story of how I had to go through all these, you know, primary care doctors, and how it was just very discouraging, because I feel the way that I feel, but the way that I feel inside doesn't always coincide with the way that my hands look or a physical presentation of clinical symptoms. So by being honest with my doctor and not being aggressive or and anything of that nature, that has really opened up the line of communication for me. And I think that I think that as patients, we get very frustrated with life in general, having to wake up in chronic pain and deal with this. And so I come from a place of like compassion and love now, and I take into consideration that my doctor is human and my doctor is a doctor, and yes, he's gone to medical school and he's under, you know, he obviously knows a lot about this, but at the end of the day, he's human and I'm human, and we're both trying to just figure out this obstacle the best that we can with the tools that we have. And so I understand that it's a trial and error process, and I come in with my list of questions and how I'm doing and the things that are going on in my life and stuff like that. And I just have really open, honest communication with my rheumatologist. And I think that through doing that, it's been able to build a foundation for a relationship. I also think that as patients, especially for me, particularly with my situation, I had to fight so hard to get heard that there was a good year where I just stopped listening to anybody else. You know, no one would listen to me. And so I became such a fighter. I was like, you're going to listen, that I lost my ability to listen. And so with developing, you know, a coalescing relationship with your doctor, I think it's also very important to listen to them. So not only us expressing ourselves to them and going in with a list and going in with all these things, but also really listening and being present and digesting what they're telling us, because we know our rheumatologists don't always tell us things we want to hear. You know, when I decided I wanted to go back into racing, they had concerns, and I was like, I don't want to listen to you. And ultimately, I had to take a step back and I had to listen, you know, just because at the end of the day, you need to put your health first and you need to focus on what is going to be the best in the long term. And so it's a collaborative measure of listening to them and them listening to you. And at the end of the day, if you don't feel like your rheumatologist is listening to you, you know, reach out to the resources that you have and try and change the situation, because if you don't feel like you have synergy with the relationship with your rheumatologist, then you need to get a new one, and at the end of the day, that's just what it is, because this is your body, your life. It's not your rheumatologist that has to go home and live in this pain. It's you that has to. And so you really need to feel comfortable with the person that you have. And once you do, it's just like any other relationship, any other partnerships. You're going to have ups, you're going to have downs, you're going to have growing pains, and that's all to be expected. But once you get to a point where you've both established trust with each other, then you really have the opportunity to build a fantastic disease management program, and I'm fortunate enough now to have that. And so now I feel like I've entered a new phase with my rheumatologist where we can communicate even more honestly, because I was like, look, I fought tooth and nail to race because I was angry and I wanted to race. And then after going through this whole spiritual journey the past 6 months and retiring, I came to a place where I forgave myself. I forgave my body for getting this disease, because we get mad and angry. And then I told that to my doctor, and I was like, I feel like I'm in a really healthy place now, and I'm able to kind of manage this in a better way as a patient. And I think that he appreciated that, and to just kind of like see that growth with me. And so it all kind of boils down to just being honest with them about where you are, because at the end of the day, they are human and we're not just a number. The first couple of years that I was living with RA, I was very angry, and it just kind of eroded my soul. And coming to a point this year of stepping back and just kind of being grateful for the opportunities that this condition has given me has really kind of changed my perspective on life. And it's made me a much lighter, like happier person. And I know it sounds crazy, because who's going to be happy to have this, it's no one's going to be happy to have it, but it's a situation. It's what we have to deal with. And at the end of the day, it's giving me the opportunity to connect with all of you and to learn about all these other things that I would never know about. I would have never in a million years known anything about a chronic disease or patience or temperance, and most of all, compassion and self-love. And so through complete self-hatred, I've now discovered self-love. And so through the communication with your doctors and through all this stuff, I just encourage everybody to get curious about what our disease has gifted us, because it really has, shown us a part of life that we probably otherwise would have never seen. And we are the most, I think that rheumatoid warriors are the strongest people out there. I think that anybody that has a chronic illness is just absolutely extraordinary. And I think that everybody should just take a minute and realize how amazing you are, even if you don't feel like it, even if you're in pain, even if you can't put on your clothes today, even if you can't get out of bed, even if you can't do anything. The fact that you can go and deal with this and still wake up every day and try, that makes you amazing. And I just really want everybody to take that away from this.